Hello, my name is Caleb Skiba, and today I'll be presenting on the 2012 Kidney Disease Improving Global Outcomes Clinical Practice Guidelines for Acute Kidney Injury on behalf of the International Society of Nephrology. Getting into it, you'll want to reference the table of contents in order to where to direct your focus while reviewing these guidelines. These guidelines are broken down into 5 main sections. Section 1 is the induction and methodology. Section 2 is defining AKI. Section 3 is the prevention and treatment. Section 4 is contrast-induced AKI. And Section 5 is dialysis interventions for the treatment of AKI. The main sections you'll mainly want to focus on are Section 2 and 3. Section 2, defining and classifying an AKI, as well as risk assessment. These 2 parts and chapters of the section help you evaluate and understand what an AKI is and what patients are at greater risk. Then moving on to Section 3, which includes the prevention and treatment of an AKI, is very important, talking about when and what to use in terms of treating your patients. Within Section 2, AKI definition, there are some useful both recommendations as well as tables that you can use to help classify and determine what patients would be at greater risk. Scrolling down to Table 6, you'll see that there's this little table that includes both susceptibilities as well as exposures that put people at increased risk. Some of the susceptibilities include dehydration or volume depletion, advanced age, race, diabetes, as well as other things like cancer. Other things that are non-based that patients could be exposed to could include sepsis, burns, or other types of trauma, increase their chances of an AKI. Moving on to Section 3, this is where you'll learn about the prevention and treatment of AKI. In this section, the chapters talk about the different types of fluids as well as different medications that could be used while treating a patient with an AKI. Throughout this sections and throughout all the other sections, you'll see these recommendations here that tell you different things that are suggested regarding different stages and different criteria of AKI. A useful area, though, within the guidelines is the summary of recommendations. This includes all the recommendations throughout the guidelines, kind of summarized into brief statements in this little area of the guidelines. This includes little useful tables on like staging of AKIs, as well as the treatment and what is needed throughout these processes. My first practice parole when treating someone with an AKI relates to patients with worsening or onset of a pre-existing chronic kidney disease. If patients are proven to have chronic kidney disease or CKD, they should be managed following the guidelines for CKD rather than the guidelines for AKI. My second practice parole relates to avoiding aminoglycosides in the treatment of patients with AKIs due solely because aminoglycosides can be very harming to the patients and only worsen AKIs. Only use an aminoglycoside if no other non-toxic alternatives are available. And lastly, one of the resources I recommend reviewing while looking over the AKI guidelines is the appendixes that KDIGO releases as well. These appendixes go over much more in detail some of the topics they talk about within their normal guidelines. Thank you, that's all I have, and have a good day.